Okay. Good afternoon, everyone, and thank you for joining us today at this media availability. At approximately 12 noon today, the state did make an announcement that there were some changes in the state's guidance relating to outdoor attendance of professional sporting events. The state is now allowing that orange tier counties they're allowing for orange tier counties to allow attendance up to 20% capacity at professional sporting events. That's not something, it's not an approach that the county is going to be taking with this new development. We are taking a more cautious approach in adherence with the values that we have always abided by in terms of limiting the spread of COVID, maintaining social distancing, limiting the capacity of how many people are going to be congregating in one place, and certainly by no means will professional sporting events have an exception to the standard procedures and the values that we have held ourselves to. So at this time, to receive media questions and provide more clarity about where the county is and the direction that we're taking is our County Executive Officer, Jeff Smith.
Thanks, Betty. Just a few comments at the beginning, then I'll be happy to take questions. We are calling this press conference because we want to make it clear that super spreader events will not be allowed within the county of Santa Clara. The changes in the state's guidelines regarding professional sports are, in our opinion, really quite dangerous. If you just do the math, 20% of the capacity at Levi Stadium means just under 14,000 people could attend a football game there. And if you look around the county and around the region, within 150 miles of this county, there are areas and communities that have positivity rates for COVID that are in the 8% range. Ours in this county happens to be around 1%. But if you do the math, that means somewhere between 250 and 1,000 people out of those 14,000 people will be infected. They'll be infected, they'll be at the stadium screaming, yelling, they'll be going to try to get food, they'll be unmasked during the time period that they're eating, they're going to be going to the restroom, they're going to be congregating, they're going to be infecting other individuals. If we have 800 people who have COVID mingling with another 13,000 who have COVID, we're going to see a super spreader event. No question, this is dangerous. This is the worst thing in the world to be doing at a time period when California is beginning to see some light. This amounts to another step backwards. We've already done steps backwards in California that have cost tens of thousands of lives. This is another risk to do this. So this county will not change its risk mitigation order, and those kinds of activities will not be allowed. So with that, I'll open it up for questions.
Jeff, hi, good afternoon. Thanks for taking time. Elliot Allman, San Jose Mercury News. Dr. Cody and the county have led from the beginning of dealing with this pandemic. Was this a point to kind of draw a line in the sand and be an example for the entire nation?
I think that Dr. Cody has consistently made decisions based on science and her expertise, and the science just simply doesn't support the concept of large congregations of individuals at the same time. Right now, the only method of treatment for COVID is to keep people apart, keep them masked, keep them socially distant. Going against that completely is bringing 14,000 people together in close proximity. So it's not really a matter of a line in the sand, it's a matter of reasonable scientific decision making instead of political decision making.
Jeff, did you talk with the State Director of Health and did you try and convince him otherwise, or were you not even brought in, you or Dr. Cody not even brought into this conversation?
Well, I should clarify, I'm here to speak for Dr. Cody because she's currently attending a Board of Supervisors meeting, so I'm her surrogate. She has been in contact with the state and tried to convince them that this is a really unwise idea, and has not so far been successful in convincing them of that.
And just to follow up, so it's not about positivity rates in Santa Clara County, that's where you want them to be. So it sounds like there's no change in positivity rates that could change the opinion, it's the matter of a vaccine. Is that fair to say, or how would you characterize it?
Well, I think the way that the order from the state is written, it's anybody within 150 miles of the stadium can buy a ticket. So if you look at 150 miles away from Santa Clara County, that includes lots of areas where the virus is out of control. Merced, Stanislaus, areas like Marin, some areas in Monterey, Santa Cruz. That is a really high risk of bringing virus into our community and increasing our positivity rates. But that being said, as you say, without some kind of other treatment besides social distancing, having these large congregations is a great risk no matter what. And we've seen that across the nation with church services, weddings, motorcycle clubs, all kinds of congregate settings where the super spreading event has occurred. Even the Rose Garden in Washington, D.C. is a super spreader event.
Dr. Smith, what criteria would you like to see before the county would feel comfortable allowing fans, even at 20%, back into the stadium?
Well, I'm not the county health officer, but what I would say is that was the very first activity that was precluded because it's such a high risk. So I would say that it'll be the last one that the county would consider opening. And in that sense, the only thing that would likely be possible to see would be dramatic decrease in positivity.
So, kind of two questions.
Statewide or here?
Hold on. So it's an open-air stadium. Is that a mitigating factor at all? And second, there have been other NFL teams in other cities and other markets that have allowed fans. Have you been able to, or have public health officials been able to trace outbreaks back to those events?
Well, that's a really interesting question. And at the beginning of this COVID pandemic, there's good evidence that a football game done in Miami caused a major spread through the Midwest and through the North. And as a matter of fact, some epidemiologists think that it was the seed that caused the big spike in New York. Now, recently, there's been changes in that process. We don't have enough data to be able to say exactly what's happened, but we do know that being together with other individuals who have COVID is a very high risk. And being an outdoor stadium changes that a little bit, but not when you have 14,000 people there that have to get through the same doors to get in and out, have to go to the same restrooms, have to go to the same concession stands. They're screaming, they're yelling. We know that's a way that the spread occurs. So it's really a minimal effect on being outdoors in that situation.
Can you clarify what the state is saying about college football games, and what is the county's perspective on that?
I don't think I can clarify what the state's saying because it doesn't make sense to me. So about college games, they're saying that they're allowed without attendance, and so I don't understand how that protects the students, the actual people who are playing the game. Whereas, for example, the NFL has in place very stringent bubble criteria for the players and the umpires and testing criteria for the players and umpires. So they're relatively protected, but that's not being implemented with regard to students playing student games.
But
So does that mean you're
college
not
is not
allowing it?
allowed
Okay,
in
guys,
Santa
right
Clara,
over here.
but can you just clarify?
Okay, follow-up question, then the gentleman over here, and then back to you, sir.
Thank you.
Okay.
But in Santa Clara County, colleges cannot have fans in attendance, correct?
Right.
Thank you.
Okay, over here.
Yeah, Dr. Smith, has anybody from the county, talked to the 49ers and the earthquakes about this decision?
Yes, both teams were notified that our order does not change, as well as the Great America and Gilroy amusement park. We're all notified that our order has not changed and activity is still prohibited.
And as a follow-up, what was their reaction? I understand the 49ers were really hoping that the state would open this up and allow them to bring people in. Obviously, it's a business for them, and that's what they're thinking about.
Well, I can't say what the reaction was because I wasn't on the phone. What I can say is they seem to know about the relaxation of the order before the public health officer knew. So I imagine they had been lobbying the state heavily.
Following up on Mary Ann's question, back to the college football. Can college football actually play now in Santa Clara County? And if not, does that change, number one? And number two, you talk about it seems like a big concern with this state policy is this 150 miles where cases are through the roof. But that's just guidance. Couldn't the county, if you wanted to, draft a policy allowing only people in Santa Clara County to buy a ticket? And if that's the case, what would be wrong with that?
Okay, first question is, yes, college athletics is allowed with a number of mitigation factors and risk reduction factors, masking and various other activities that are required, not with audiences in attendance. And I think the real problem with this state change in the order is not specifically the 150 miles, but the fact that you bring so many people together at such high risk. Now, allowing it to be spread among citizens 150 miles in diameter away from the stadium makes it even worse, but even if it was 1% and even if it was just citizens of the county, it would still be very risky.
Yes, I guess the question I have is, the football season is underway, sports have resumed. At what point at which do you think what would the conditions have to be where you would feel comfortable allowing some number of fans into a 49er game or a Sharks game or an Earthquakes game?
I think that question's better answered in the negative, and the fact is that throughout the nation, the virus is spiking. Basically, all of the health experts in the nation that are respectable have predicted another spike in November and December. It's going to get worse. It's going to get a lot worse. Right now is not the time to be relaxing regulations. And in terms of predicting the future about when it might be okay, that really depends on the virus and depends on compliance with social distancing. We know right here in this county, we started with the first death in the United States, in the continental United States. We started as a hot spot, but because the people of this county were vigorous in their social distancing and sheltering in place, we knocked down the incidence of virus considerably. Now it's beginning to go back up, mostly because we're not an island. So California is not an island. The nation is getting worse. Last numbers I saw is 30 out of the 50 states are seeing major uptrends. There's some hospitals that are filled, ICUs filled on the East Coast. New York's beginning to see another uptrend. Now is not the time to start thinking about getting a lot of people together in one place.
In a big picture kind of way, Dr. Cody and all the people in the county are public servants, and they're looking to protect their constituency. How crazy is it to even, why are they playing sports, which seems to be, I realize it's a business, but then the college thing, as you pointed out, it's not, and that's a big question. But, I mean, Does it just boggle your mind that they're actually trying to do this in the middle of a pandemic?
Okay, I'm just speaking for Jeff Smith, not for Dr. Cody or for the Board of Supervisors. But from my perspective, it not only boggles the mind, it's just unconscionable. Basically, they're putting lives at risk. People who think that they're safe are going to be at risk. People at home, not just the people who attend the games, will be at risk. And we haven't even opened schools. We are still worrying about businesses being able to survive. It makes no sense whatsoever to have audiences at stadiums, particularly when there is a model to do it without audiences in a much safer way, so that the only individuals who are being put at risk are the players, the refs, and their families, but they're getting constant tests. So putting an audience in a stadium in large groups is just asking for trouble. It's like a petri dish.
Thank you, everyone. So that concludes our media availability today. We do have a Spanish language spokesperson here at the county. If anybody would like a Spanish language media interview, we also have Vietnamese language capability too, if there's any members of the Vietnamese press here.
Thank you.
Thank you, Dr. Smith.
Okay.
Thanks, Dr.
Thank you.
Thank you.
Thanks.
Thank you.
Okay. We're going to do a Spanish language PSA now.